March is Colorectal Cancer Awareness Month and a good time to highlight some key facts about colorectal cancer. I'm Dr. Eleanor Toplinsky. I'm a board-certified medical oncologist. The incidence of colorectal cancer is rising, and it is now the leading cause of death in men and the second leading cause of death in women under the age of 50. In terms of colorectal cancer screening, the standard or the gold standard is a colonoscopy. For people at average risk of colorectal cancer, the guidelines now recommend starting screening with a colonoscopy at age 45. It used to be 50, but due to the increasing incidence in younger people, they changed the screening age just from 50 to 45. Now, some people who are maybe at higher risk of colorectal cancer based on genetics, based on family history, based on personal history, would be recommended to start colorectal cancer screening at an earlier age, and that's something that you would talk to your doctor about. There are alternatives to colonoscopy for colon cancer screening, such as Cologuard, which is a stool-based test. They're not as good as colonoscopy, but what I tell my patients is I'd rather you do something than not do any colon cancer screening at all. And I can talk a little bit more in future videos about colonoscopy versus Cologuard, pluses and minuses. Screening tests are for people who are asymptomatic. You do not have any concerning signs or symptoms that you may actually have colon cancer. So those are for asymptomatic people. Now let's talk about signs and symptoms of colorectal cancer. They vary, and certainly some of these symptoms could be related to other things, non-cancerous things, but they warrant evaluation. So what are they? Changes in your bowel habits, constipation, diarrhea, changes in stool consistency, seeing bright red blood in the stool, dark stools, black stools, abdominal discomfort, bloating, gas symptoms, nausea, vomiting in some cases, feeling tired or fatigued, weight changes. And as you can see, each one of those side effects can be related to something else. But if you're having new symptoms and you're not sure if you should be worried, if these are concerning, go check them out. Go talk to your doctor, who will take a history, will get all that information, and then, act from there. Let me know what questions you have about colorectal cancer, symptoms, screening, treatment. Happy to answer them.